If you're injecting your Ozempic pen this way, you could be putting yourself in danger. One of our patients nearly faced a life-threatening complication during surgery because she didn't know the warning signs. Another thought reusing needles was safe until she ended up with an infection that the CDC flags as one of the most serious injection mistakes. And it's not just rare cases. I've seen patients waste half their dose from the wrong angle or a panic over medication bubbles that weren't dangerous but still sent them to the ER. I'm Dr. Jones DC, and I've helped thousands of patients optimize GLP-1 injections, and today I'm breaking down the 5 biggest mistakes and then show you how to properly inject so that you can avoid these mistakes. And mistake number 3 is pretty crazy. Okay, so the most dangerous mistake, and it's more common than you'd think. Watch what people do here. They think wiping with alcohol makes it sterile, or they're trying to save money on needles. Michael, one of our patients, construction worker, lost 78 pounds. He told me, "Doc, I sanitize my tools at work, so I figured sanitizing these needles was fine." Makes sense, right? But here's what Michael didn't know. The CDC identifies needle reuse as one of the most serious unsafe injection practices due to substantial bloodborne pathogen transmission risk. Essentially what they're saying is it's so easy for you to get bacteria by reusing needles, even a single time, even when it's super clean and sterile. Those microscopic blood particles, the alcohol doesn't eliminate them all. Plus, that needle gets duller with every single use, like trying to push a thumbtack through leather. Michael learned this the hard way with an injection site infection, 3 days on antibiotics that cost him way more than a year's supply of needles. Don't ever make this mistake, no matter how clean you think you are. Just grab a complete fresh needle. Sometimes it's not even a money thing, it's a time thing. Don't make that mistake. Okay, so here's what works. New needle every injection. Now, you'll want to check with your doctor, but here's what I tell my patients. I get it. Needles cost money, but a box of 100 quality needles, we're talking Medifine 32 gauge. That's what I recommend. It's about $15. That's about 15 cents per injection. Hepatitis C treatment often costs $80,000 to over $100,000 per course in the US. Which gamble would you rather take? Now, here's exactly what you do. You remove the paper tab, twist clockwise until secure. After the injection, recap using the outer cap on a flat surface, never with your hands, then straight into your sharps container. Pro tip, when traveling, Ozempic pens contain 4 weekly doses, so pack accordingly. 4 needles per pen plus 1 backup. At the end of the day, would you share a needle with somebody else? No. Then don't share it with yourself 3 days later. Simple enough, but we have to hammer that in. Okay, mistake number 2, the priming confusion. Now, mistake number 2 is literally throwing money away. You see that drop? If you're priming before every injection, you're wasting expensive medication. People learn this from insulin, but Ozempic works differently. Sarah, an investment advisor that I work with, was essentially reducing her 4 weekly doses by priming unnecessarily. Here's what most manufacturers recommend. Prime once when you first open a new pen. Check your specific pen's instructions, but unlike insulin pens, most GLP-1 pens, they don't need priming before every injection. Turn to the flow check symbol, point up, press until you see a drop. This pen is now primed for all 4 weekly doses. If this just saved you money on your wasted medication, then hit that subscribe button, because we put out 2 videos every single week showing you insider GLP-1 optimization tricks that your doctor might not even have time to explain. Speaking of saving medication, wait until you see this mistake. Number 3, this mistake turns your full dose into a partial dose without you even knowing. Watch what happens when you pull out too fast. You see that medication dripping? Research shows medication leakage can occur in nearly 30% of injections when the needle is withdrawn immediately. But waiting just a few seconds cuts that dramatically. David, a software engineer, came to me on a 3-month plateau. He had told me, "I'm efficient, doc, in and out, 2 seconds max." But that efficiency, it was sabotaging his results because the medication was literally backing up and leaking out. Ozempic is thicker than insulin. It needs time to fully deploy. Here's the exact technique. Insert at 90 degrees, press the dose button. When the counter hits 0, that's when you start counting. 1 Mississippi, 2 Mississippi, all the way to 6. Studies show that even 3 seconds dramatically reduces leakage, but 6 seconds gives you extra insurance. Keep your thumb pressed the entire time. You might hear a click. That's normal. Only after 6 seconds do you remove the needle. David fixed his technique and broke through his plateau in 2 weeks. 6 seconds, hands down, one of the simplest fixes with the biggest impact. Quick question for you. If you made it this far, what surprised you the most? The priming waist or the 6-second rule? Drop it in the comments because your experience helps everyone in our community learn. Now on to mistake number 4, injecting at the right angle. This mistake can waste half your medication and it might even send you to the ER unnecessarily. Going in at the wrong angle doesn't just hurt, it can destroy your absorption. Too shallow, you get a bubble. Too deep, you hit a muscle. You don't want to hit one of these guys. You want to make sure that you're injecting into fat tissue, not muscle. Lisa, a real estate agent who'd lost 89 pounds, called us panicking one night. There's a bubble underneath my skin. Is it dangerous? She was already driving to the ER. My medical practitioners told her to turn around. That bubble meant that she went too shallow. The medication pulled underneath her skin instead of reaching to the fat layer. And that's where you want to inject. $3,000 ER visit avoided with just a 2-minute phone call. Here's the proper technique. That guarantees subcutaneous injection, which means into fat. Always go straight in, exactly 90 degrees, not angled. Pinch your skin. Yes, even if you have extra weight, this lifts the fat layer away from the muscle. These 4mm needles, they're designed to reach the perfect depth for that subcutaneous fat injection. Clinical studies show they work for virtually everybody, regardless of your body size. If you're using your thigh or arm, that pinch is critical. Belly, still pinch, but you have more margin for error. If you see a bubble after your injection, you went too shallow. Next time, pinch more tissue to ensure that you're at 90 degrees. That bubble will absorb. It's not dangerous, just inefficient. Remember, straight in, full depth, pinch the skin. Lisa hasn't had a bubble since. Now, mistake number 5, this one's big. This last mistake is completely invisible, but can reduce your absorption dramatically. Using the same lucky spot creates scar tissue underneath your skin. It's a medical term called lipohypertrophy. You can't see it, but it's there, blocking your medication in many cases. Studies show that insulin absorption at these damaged sites can be 27 to 94% lower. That's potentially getting less than half your dose. Jennifer, a mom of 3, always injected in the same spot on her left belly. It's convenient, she said. Plus, she was injecting cold medication straight from the fridge, which the manufacturer specifically says to avoid for comfort reasons. Double the trouble. Scar tissue forming and painful injections from cold medication. Here's the rotation system that guarantees maximum absorption. Divide your injection sites into zones. 4 quadrants on the belly, staying 2 inches from the belly button, 2 zones on each thigh, 2 zones on the back of each upper arm. Week number 1, right belly upper quadrant. Week number 2, left thigh outer. Track it on your phone. Never hit the same zone within 4 weeks. And here's what you got to know about absorption. The research shows that collectively absorption is about the same, but individual variability does exist. So find the area that works best for you, but just remember, even if you find your sweet spot, you still want to rotate within that area. This will help you prevent random hunger controls and times when the medication isn't working when you need it most. Always let your pen sit at room temperature for 30 minutes before injection. The manufacturer recommends this for comfort. Cold injections can sting and cause those painful red welts. While insulin studies show warmer medication may absorb better, we don't have that data yet for GLP-1s, but here's what we do know. Patients report significantly less pain and bruising with room temperature injections. Your pen is good for 28 days at room temperature after first use, so there's no downside to letting it warm up. Room temperature versus cold injection, which do you prefer for comfort? The manufacturer says 30 minutes at room temperature, it reduces pain, but I'm curious what you've experienced because I've had patients tell me otherwise. Okay, so 3 critical reminders that could save you serious complications. Number 1, if you're having any surgery, tell your anesthesiologist about Ozempic. The American Society of Anesthesiologists issued guidance in 2023 about potential aspiration risks, essentially choking, during surgery from patients taking GLP-1 medications. That patient that I mentioned, this guidance exists because of concerns like hers. Number 2, and this is exciting news, recent studies indicate that the landmark FLOW trial showed promising kidney protection benefits. Though this isn't yet FDA approved, if you're having kidney concerns, discuss with your doctor about potential benefits. And third, let's recap these 5 mistakes real quick here. Step number 1, my pen's been sitting out for 30 minutes. Room temperature for comfort, check. Step number 2, brand new needle, twist on clockwise until secure, not over tightened. Step number 3, this pen was already primed when I first opened it last week, so no priming needed today, saving medication. And step number 4, checking my rotation tracker. Left thigh outer zone today, haven't used that spot in 4 weeks. All right, let's go. Step 5, here we go. Pinch the skin to lift the fat layer, even on the thigh, going in at exactly 90 degrees, straight in, not angled. Step 6, press the dose button all the way down, counter hits 0. 0. Now I start counting. Keep the thumb pressed. 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi, and 6 Mississippi. Step number 7, remove the needle straight out. Recap it safely using the flat surface method, never with your hands, straight into the sharps container. Perfect, no bubble, no leakage, full dose delivered. That's how you do it right. Look, I've been where you're at. I've lost 100 pounds myself years ago, and I know how frustrating it is when you're doing everything right, but you're not seeing the results. In our practice, we see patients break through plateaus just by fixing these injection mistakes. No dose increases needed, just proper technique. These 5 fixes could be the difference between struggling and succeeding on your GLP-1 journey. If you're still not seeing results despite proper technique, we can help. Our coaching team specializes in optimizing GLP-1 medications, so book a discovery call. I'll leave a link in the description. And if you're curious about the bigger picture here and you want to learn more about the 10 most common mistakes, check out this video right here where I break it all down. And we'll see you guys later.